The good, the bad and the ugly of the My Health Record. The My Health Record is an individual's medical history in digital form. It includes information about the person's diagnosed medical conditions, prescribed medications and allergies. Doctors can upload notes from each consultation, and the system will eventually include test results, hospital discharge summaries and other data that can be shared between healthcare professionals. The My Health Record gives patients control over their own health information, such as 24-hour access to a summary of their health information from anywhere in Australia, the ability to keep track of their medications, immunisations and allergies, more understanding of their health status and more involvement in the healthcare decisions affecting them, and the ability to share important health information with all healthcare providers involved in their care. The big advantage of the system is that it uses modern technology to get us all the best care fast. Doctors can use the My Health system to access information on a patient's condition and treatment to date, seek advice from specialists and colleagues, to prescribe medication, to order tests or hospitalisation, and to update the patient's record, all in real time, regardless of location, and from the convenience of a smartphone. There's evidence that the electronic medical records make healthcare safer by reducing documentation errors to be less than 5%, compared with the paper error chart rate of 10%. It also spreads the dollar further. A 2010 report calculated that fully digitising the Australian healthcare sector would realise an estimated $7.6 billion in annual savings by 2020, plus additional savings through economic flow-on effects. But it's not all good news. The government says that your confidentiality is assured, but in August this year, a major international technology company, CSC, warned medical practices not to use the My Health Record because of a software problem that allowed data from one patient to be saved against an incorrect patient record. Access to your My Health Record is limited or prohibited to health professionals nominated by you, but we don't know exactly how that works or how they're identified and verified. Since My Health allows individuals to select which part of their health record to share, hide or remove, doctors may end up working with incomplete medical histories, which creates a clinical risk. For an electronic health system to work, it needs to cover virtually all patients and doctors, but since the eHealth Record Plan was first launched 4 years ago, less than 10% of Australians have set up a My Health Record, and AMA President Professor Brian Owler stated that in the same period, doctors entered only 75,000 records. Recent studies measuring the relationship between electronic medical records and an improvement in quality of care show that most are unable to demonstrate improvements in patient outcomes. Which leads us to 5 ugly truths to bear in mind. 1. Your privacy is compromised. Research by the Office of the Australian Information Commissioner says practices are at medium to high risk of breaching privacy laws when using the My Health Record because of weak and unsecured passwords, unlocked computers, and unauthenticated access to data. Encryption can't be relied on either. Last month, private medical records that were supposedly de-identified by the Department of Health turned out to be decodable, causing the minister to apologise. 2. The record is not accurate. Early this year, when the Department of Health was setting up My Health records for 1 million people in the compulsory trial, it used incorrect and out-of-date data. They even set up records for people who had been dead for decades. In 2013, a woman discovered that 2 prescriptions had been added to her eHealth record for drugs never prescribed to her for medical conditions she did not have. 3. Your taxpayer dollars are being misused. Up to June 2016, the Australian government spent $1 billion on the scheme. That means that each functioning eHealth record has cost taxpayers over $13,300. In 2012, NETA, the authority in charge of the My Health Record, spent over $5 million in travel and entertaining stakeholders in 5-star hotels. Under the Practitioner Incentive Program, from May 2016, GPs are required to shared health summaries of 0.5% of their patients per quarter, and in return they receive an eHealth incentive payment worth $50,000 a year. Is this bribery? And is it in your best interests? To date, over 1,500 practices have failed to meet the new targets. The government has responded by extending the deadline and allowing practices to retain the incentive payments that they have not earned. We can't even guarantee a constant power supply. Ask yourself what happened to patients relying on their My Health record in South Australia during the recent statewide blackout. And finally, governments are cynical. When you consider the range and depth of the flaws in the My Health system, ask yourself why the government is persisting with it. Could it be the government just wants to be seen to be participating in some form of digital health strategy, rather than having to devise a more secure and workable alternative to the My Health record?